ICD 10 cm Practice Questions and Answers 2026 with explanations. 35 Fundamental Questions. Question 1. In ICD 10 cm, a placeholder X is used for what purpose? To allow for future expansion and meet code length requirements. To indicate an unknown diagnosis. To show a surgical complication. To mark a primary diagnosis. The X placeholder is used in certain codes to allow for future expansion or to fill out a code to 7 characters. Question 2. Which section of the ICD 10 cm guidelines addresses outpatient coding? Section 4, Section I, Section 2, Section 3. Section 4 provides guidelines specifically for outpatient services. Question 3. A patient is seen for a follow-up after a completed treatment. Which code type is used? Z codes, acute codes, external cause codes, procedure codes. Z codes are used for factors influencing health status and contact with health services, including follow-up. Question 4. In the ICD 10 cm tabular list, brackets are used to enclose synonyms or alternative wording, indicate a mandatory secondary code, highlight new codes, show exclusions. Brackets in the tabular list enclose synonyms, alternative wording, or explanatory phrases. Question 5. What does excludes one note mean? Not coded here, the two conditions cannot occur together. Not included here, but may be coded if both are present. Code first the underlying condition. This is a placeholder. Excludes one is a pure exclusion note. It means the code excluded should never be used at the same time as the code above it. Question 6. Sequencing rules state that if the same condition is described as both acute and chronic, the acute code is sequenced first. The chronic code is sequenced first. Only the acute code is used. Only the chronic code is used. If separate codes exist for acute and chronic versions, and both are present, sequence the acute code first. Question 7. Which code should be listed as the principal diagnosis? The condition established after study to be chiefly responsible for admission. The most expensive treatment provided. The first condition mentioned by the patient. The chronic condition the patient has had the longest. The principal diagnosis is the condition that prompted the hospital stay. Question 8. External cause codes, VY codes, are used to describe how an injury or poisoning happened, identify the primary disease, code surgical procedures, indicate the hospital department. External cause codes provide data on the cause of injuries, such as falls or car accidents. Question 9. What is the significance of the 7th character in ICD 10 cm? It often indicates the encounter type, initial, subsequent, sequela. It is always the letter A. It indicates the severity of the illness. It represents the insurance provider. For many injury and poisoning codes, the 7th character identifies the phase of care. Question 10. Code also instructions in ICD 10 cm mean. 2 codes may be required to fully describe a condition. The code is optional. Use this code instead of the primary. The code is for research only. It alerts the coder that another code might be needed for a complete description. Question 11. The alphabetical index should be used first, before verifying in the tabular list. Only if the tabular list is unclear, instead of the tabular list, to find procedure codes. Coders should always look up the term in the index and then verify the code in the tabular list. Question 12. In ICD 10 cm, NOS stands for Not Otherwise Specified, Not on Schedule, New Operating System, Number of Symptoms. NOS is the equivalent of unspecified. Question 13. Late effects of an injury or illness are coded as sequela. Acute. Initial encounter. Complication. Sequela refers to the residual effect after the acute phase of an illness or injury has terminated. Question 14. When a patient has a bilateral condition and no bilateral code is available, assign separate codes for both left and right sides. Code the right side only. Code the left side only. Assign an unspecified code. If no bilateral code exists, assign codes for both sides. Question 15. Symptoms and signs are generally not coded when a definitive diagnosis has been established. The patient is in the ER. The insurance doesn't require them. They are severe. If a diagnosis is confirmed, the symptoms integral to that diagnosis are not coded separately. Question 16. The ICD-10-CM code for a routine pregnancy checkup is found in which chapter? Chapter 21, Z codes. Chapter 15, Pregnancy. Chapter 1, Infections. Chapter 18, Symptoms. Routine prenatal visits without complications are coded using Z codes from Chapter 21. Question 17. NEC stands for Not Elsewhere Classifiable. New Entry Code. Non-essential component. Next Encounter Code. NEC is used when the information in the medical record is specific but the classification doesn't have a specific code for it. Question 18. Which organization maintains the ICD-10-CM classification in the U.S.? National Center for Health Statistics, NCHS, and CMS. American Medical Association, AMA. World Health Organization, WHO. Food and Drug Administration, FDA. While who owns ICD, NCHS and CMS maintain the clinical modification, CM, used in the U.S. Question 19. In the tabular list, includes notes appear immediately under a 3-character code title, at the end of a chapter, only in the index, in the back of the book. Includes notes clarify the content of the chapter, section, or category. Question 20. Primary diagnosis for an outpatient encounter is defined as the reason for the encounter, the most severe condition, the oldest condition, the most expensive condition. In outpatient settings, the first listed diagnosis is the main reason for the visit.